and welcome back to my channel, the Tooth Talk Studio. I am Dr. Veena, General Dental Surgeon at ASHIRVAD Dental Clinic, KUDUR, Bangalore South District, and today I'll be talking about another branch of dentistry, that is periodontics. Have you ever wondered why dentists always talk about healthy gums? Or have you ever noticed your gums bleeding when you brush, though you do it regularly? Today we'll be talking about this branch in detail. Now, perio means around and dontics means teeth. So periodontics is about the foundation that holds your teeth in place, that is the gums and the jawbone. Think of your teeth like trees. Your tooth is the trunk, but your gums and jawbone are the soil. If the soil is healthy, the tree stands tall and hale. If the soil gets weak or washed away, the tree is going to wobble. That's exactly what this department is all about. Let's look at what actually is going on a healthy mouth. When you are looking at your beautiful smile, you see the teeth, but right under your lips, you have your gums which are tightly hugging your teeth. Under the gums is the bone. When gums are healthy, they snug around the teeth. So, this is how a gum disease looks like. Swollen gums on the sides, and a lot of tartar that is accumulated on the tooth. These bleed. These are the first little red flags. That means the bacteria is present in the gums. If you keep brushing and flossing, you can get rid of this swollen teeth. Stage 2, periodontitis. That is, the gums have just shifted away from the tooth and there is swollen gums, and the tartar has accumulated below the gum line than it is supposed to be. What happens if you ignore this bleeding? Then this gum disease is called as periodontitis. The bacteria stay trapped under these gums. They calcify into hardened tartar. Because of the hard brushing, it cannot be removed. This constant irritation causes the gum to pull away from the tooth. The snug formed gums now sags, creating a depression which is known as a periodontal pocket. So the gap that you can see, the gap between the tooth and the gums, this area is called as a pocket, a periodontal pocket. The big difference between swollen gums and periodontitis is bone loss. The bacteria and the toxins triggers the body immune system to fight back, but in this process your body actually starts dissolving the jawbone that is holding the teeth in place. Once the bone is gone, unfortunately it's gone forever. At this stage the teeth start loosening. Treatments like deep cleaning and root planing are advised to smoothen out the roots and clean out the bacteria so that the gums can heal and stop the disease in its track. Stage number 4 is advanced periodontitis. If stage number 2nd and 3rd is left untreated, it advances to stage number 4. The causes of gum infections are poor oral hygiene, genetics. The inherent weak immune system can also lead to gum infections. Smoking is a major risk factor. It cuts off the blood flow to the gums, leading to gum infections. Stress and diabetes. High stress levels and uncontrolled diabetes can lower body's immune system. What are the warning signs of these gum infections? Bleeding gums, that is the most common sign. The second is bad breath. Bacteria in the mouth produce smelly gases. If your breath doesn't smell good, it's a sign of a gum disease. Receding gums, the gums shrinking from their original place, thereby exposing more of the tooth structure and the bone structure, is one of the signs of the gum infection. Loose teeth. If your teeth feel mobile while you chew on it already has compromised gums. How do we diagnose and treat? Most patients think when my gums don't hurt, they are healthy. But periodontal disease is a silent killer until it advances to pain and loosened teeth. It is never diagnosed. We use a periodontal probe. This is the periodontal probe which measures the tiny space between the gums and the teeth. So 1 to 3 mm, there are ratings on this. 1 to 3 mm is considered healthy. 4 mm or more, gums have pulled away, creating a pocket where bacteria hide and destroy bone. Periodontal disease is deep cleaning, which means scaling, and root planing, which removes the hardened tartar, thereby reattaching the gums and the roots in its place. For more advanced cases, we refer the patient to a periodontist who performs minor surgery to lift the gum back and clean out the deep bacteria and also do a bone graft if required. How do you prevent and how do you care it at your home? We have talked about all the problems. So let's look out for the positive side of this. You have the power to protect your smile. First, the right toothbrush. Use a soft bristle toothbrush or even better, an electric toothbrush. Second, don't forget the spaces. Using a floss or interdental brushes daily removes the trapped food between the teeth. Third, the regular checkups. Visiting your dentist every 6 months can prevent gum diseases. If your gums are healthy, your teeth are going to have a strong, beautiful home to live in. Don't wait for your gums to hurt or your teeth to get loose. Brush gently and don't skip dental visits. Button and subscribe to the channel. Thanks for watching.